Good evening, and welcome to Behind the Shadows. My name is Susan Finelli, and I am your host and author of Behind the Shadows, a program where we go behind the shadows of what meets the eye. This evening, we will be going behind the shadows of the role of the doula. Our guest tonight is Kristy Zadrozny. Kristy is the founder of the Village Wellness Project, which is a center for family health and wellness in Union Square, Manhattan. The Village Wellness Project offers alternative health care for the whole family. Their services include acupuncture, massage therapy, psychotherapy, couples counseling, nutrition support, yoga, and meditation. Kristy specializes in maternal child health by supporting women in pregnancy, childbirth, and early postpartum care. Kristy, welcome to Behind the Shadows.
Hi, thanks for having me.
It's a pleasure to have you here this evening. I understand that the word doula comes from the ancient Greek of female caregiver. Is that correct?
Correct.
So tell me, what is a doula?
The role of a doula is to support a woman in pregnancy and labor. Her role is to help a woman have a satisfying birth experience. So for each woman, it's different. And what I really try to do is help women explore what they need during that time.
Well, what's the difference between a doula and a midwife? Because getting ready for the show, and I've been telling friends and other producers I'm having a doula on, and they say, oh, is she a midwife? I said, I don't think so.
The roles are very different. A midwife is a medical professional, whereas a doula is a non-medical professional. She's a support person, so she helps with emotional and physical support.
Okay, now I understand you have a BA in anthropology.
Correct.
And you're pursuing a master's degree in maternal child care?
Yes.
So how'd you wind up a doula?
Well, it's interesting. My clients brought me to it. I started as a massage therapist, and I got a job in Crown Heights, Brooklyn, working with the Orthodox Jewish community. And so I went from doing like 1 prenatal massage a week to doing 8. And my clients started asking me to attend their births with them. And so I learned what a doula was by them, and I did the training, and within a week of my training, I went to my first birth.
Wow.
So I was sort of thrown into it.
So talk to me about your first birth.
It was really exciting. I was very lucky because the woman who was mentoring me, Shayna Eliev in Crown Heights, she's a doula and a massage therapist. She was at a birth and she got sick, the doula. So she was sick for the whole thing, and she needed someone to come and be the physical support.
Right.
So I was so excited. It was 11 o'clock at night. I got the phone call. I jumped in my car and I went, and it was like a very typical birth. So everything I learned was happening, and I was checking everything off the list, looking for the things I was supposed to. And yeah, it was very exciting.
Was that difficult for the mother, because she went through her whole 9 months with the anticipation of someone else as her doula, and then lo and behold, here comes Kristy? How was it emotionally for the mother? Well,
I was a little bit worried about that. I wasn't sure what it was going to be, but I walked into the room and she threw her arms around me during a contraction. So she got over it pretty fast too, because she needed somebody.
She needed help, yeah. Now, are doula styles different?
I think so. I think it has a lot to do with the individual personality of the doula. I really like to reflect what my clients need, so each person's different, so I try to give them that. But my personality, or my style, I like to say, is like tough love. It's loving but firm at the same time, and help my clients stay on the track that they want to be on.
Well, how do they know what track they want to be on?
Well, we spent a lot of time talking about it prenatally. So I learned after probably 20 or so births that when things are going to come up in labor, and if we don't talk about it, there's no way we're going to be able to deal with it in the moment. So prenatally, we meet quite a few times, and we go over all of their fears, their hopes, and I arm them with a list of questions to ask their care provider, whether it's an OB or a midwife, so we all know what to expect.
Have you ever had a birth where something just came out of left field, like you never expected this to happen?
Yeah, I think, for sure.
And give us an example of what can happen that you go in, this is going to be a great birth, and all of a sudden out of the sky, what happens?
Well, like if a woman has a lot of anxiety and we didn't really explore the anxiety, and it comes up in labor, and suddenly, even though we spent so much time preparing for, say, a natural childbirth, there's a fear there that we didn't know. For for example, one woman, her labor was really slow and it wasn't progressing and we couldn't figure out what was going on. So I started asking her questions, trying to figure out, what's on your mind. And it came out that she was worried her husband wouldn't make enough money to support her and the baby.
A little too late.
Yeah, so it came out like in the process of birth. And so, I said, I'm going to give you guys 10 minutes to talk. I'm going to walk out of the room. And things did progress after that. But
I sure hope so.
Yes.
What is your relationship with the doctor? And does the doctor resent you being there?
I think when I first started, I might have been really idealistic, and I don't know if the doctor resented me being there, but we might have had different agendas. And then what I learned is to really work with the doctor and work with my client, because my client chose that doctor. And so it's their birth. And if they pick that doctor, it's for a good reason. And so I want to identify what my client's needs are and make sure she asks her doctor the right questions. So when we're all together, we've already gone over it.
Do you ever go to prenatal doctor's visits?
Yes, I do.
You do?
I like to. We will have what we call the birth plan talk at home, me and the parents, and we go over all the possible scenarios for the birth, and then they bring that birth plan to their doctor, and we go through it, and we all sign off on it. And so, yeah, that way we know we're all on the same page, literally.
Now, a midwife, that birth does not take place in hospital, correct?
It does. It can be at a hospital, at home, or a birthing center. A midwife is geared towards normal childbirth. An obstetrician is looking for pathology in labor, so they're trained surgeons.
Right.
So the difference is if a woman's not high risk, if there's no reason for a pathology to come up, a midwife is a good option.
Have you ever worked with a midwife?
Yes.
You have. And so explain the differences, as a doula, what your personal experience has been with a doctor and a midwife.
A midwife tends to just sit back and watch.
Oh.
She said she doesn't feel that she needs to add or change the progress of the labor, whereas a doctor wants to see things happen in a certain way. And so if something deviates from the normal, which is everyone's so different, then the doctor feels they need to start an intervention usually. Of course, there's midwives who act like doctors, and there's doctors who act like midwives, so it's really very specific to the care provider.
Have you ever been in a midwife birth where you had to get a doctor involved?
I've been to home births that have transferred to the hospital,
They've transferred to the hospital, yeah.
Yeah, and so once we transfer from home, then a doctor become.
Now, what's the role of the father? I mean, kind of like the father has to be involved in this, I'm assuming, somehow.
Oh, yes.
Yeah, and I mean, do they feel threatened, or are they very happy that you're there to do all the work?
Usually they're very happy I'm there, but I don't do all the work. What I do is I encourage him to be he's the main support person, and I'm complimentary. So generally we'll take turns in the labor. They say a woman's been laboring all night, and I'll go first thing in the morning. So they call me when the two of them aren't coping on their own anymore.
I see.
And so then I come and the doctor will go lay down. The husband will go lay down, and I'll work with the woman until we're ready to go into the hospital.
So if it's, let's say, a 3-day labor, which, I mean, today would be a C-section, that wouldn't happen, but if it does happen, are you there the whole 72 hours?
I am, yeah.
72 hours.
Sometimes, we take turns napping, me and the husband or partner, and only once have I had to call in a backup doula after, I think, 2 days. She came and I slept for 6 hours, and then, so then there was 2 doulas, a midwife and acupuncturist, all together working with this woman.
With this poor woman.
Yeah, who was in labor for 3 days.
Yeah. Oh, for goodness sake. Was it one baby?
It was one baby.
One baby.
Yeah.
One big baby?
Yeah, I think the baby was pretty big.
Yeah, I can imagine. Yeah. So I guess with the father, then, it's however he's comfortable with the situation?
Yeah, so I talk to him.
Lead?
Yeah, I let him lead.
Oh, I see.
And I fill in what he's not doing. And we talk prenatally about how he can be a good support. And so I might encourage him to say, make sure she's drinking enough fluids. Don't ask her if she wants fluids, just give her water. And so I try to show him, by doing it, this is what you can do to help her.
I see. Now, when the father is involved, I remember many years ago when fathers were first attending births, someone I worked with, he passed out in the delivery room, and I remember he said, that the doctor said to the nurse, "How is Mrs. X?" And she said, "Forget about Mrs. X. Mr. X is on the floor." Have you had experiences like that?
I've had husbands have to sit down. I sometimes bring like essential oils or something to get them to help them breathe a little bit better because they tend to hold their breaths.
The fathers.
Yes. But yeah, I recently, the last birth I was at, the father woke up with a stomach virus.
Oh.
So he was sick the whole day and he was sleeping on the chair in the hospital.
Oh my goodness.
And the nurses were coming in like, what's with this guy? But he was just very ill. So
the thing was sick.
Yeah, so that's another reason why it's good to have a doula, because you don't know what's going to happen on the day.
Right.
You could wake up sick or you could just pass out.
Like this person I know, he passed out cold.
And then so there's the woman in labor all by herself without somebody there to support her.
Exactly. And this was back in the 70s when it was first in vogue for the fathers to be there. And I guess he didn't have any experienced men to talk to about what to expect. What to expect. Are you always with the mother at the beginning of the pregnancy, or are you ever called in the 11th hour?
I'm usually hired around 20 weeks, somewhere between 20 and 30 weeks, but there's been times when I've had clients call me at 38, 39 weeks, and they're due to deliver around 40 weeks, so I don't know very much about them, and I'll get a call that they're in labor, and I'll show up, and we get to know each other in the process.
Right.
But I prefer to get to know them ahead of time.
Now, I understand, and correct me if I'm wrong, that you also can be involved, like even picking the obstetrician. I mean, not the physical, but the type of doctor that they should be looking for.
Well, I help them explore their needs. So, for example, if a woman's dead set on having a natural medication-free childbirth, and she happens to be with a very interventionist doctor that I know about, I let her know you might want to ask him these questions to find out how he feels about these things. And generally, if you go, they'll go to their doctor's visit and ask something like, "How do you feel about epidurals?" And the doctor says every woman gets an epidural, but she doesn't want one. That's a message there that she should start shopping around.
Right.
Because you're paying someone to do a service for you, and you want them to do it the way you want it done.
And I mean, would a doctor really say you have to have an epidural?
They can't legally, but they have their way, their comfort zone. And so you want to make sure your doctor's in the same comfort zone as you are.
Now, I understand there's more than one type of doula. There's a labor doula, and that's what you are?
Yes.
Right. And then what is it, an antepartum?
Like a postpartum doula.
Postpartum doula. Talk to us a little bit about that. And can the same doula do both roles?
Of course, yeah. So a lot of doulas do that. I'm a labor doula, but I'm also a prenatal massage therapist, so a lot of the work I do is prenatally. I'm also a certified lactation counselor, so after the baby's born, I help women nurse their babies. A postpartum doula's role is to make sure mom and baby bond. So they show up after birth and they take care of everything. So all mom has to do is feed and hold her baby. And so that usually is like laundry, cooking, shopping, keeping in-laws out of the house, keeping too many visitors out.
Good luck with that. Good luck with that one.
So that's what she does. And what I do is I prepare for labor, and I'm there for the actual delivery.
Right. And then are you there once there's the delivery? If, let's say the woman is not breastfeeding, because if she's breastfeeding, then you definitely have some intervention with the baby. But otherwise, do you have an intervention with the baby?
I help her bond, So I'm there to make sure, I stick around after the birth for a good 2 hours to make sure mom and baby and dad are all comfortable and quiet and snuggling, and then I'll leave.
And then do you come back?
I usually come back within 3 days.
Okay.
To help with breastfeeding. And if they're not breastfeeding, it's still, they might have questions about schedules and
Have you have had an experience where a mother's not bonding? I mean, I've read about that there are mothers that don't bond with their babies. Is that depression? What is that?
I think I've had women who've had complicated postpartum times. And there is such a thing as postpartum depression. And so studies do show that having a doula reduces the risk of postpartum depression because it's helping a woman have a satisfying birth experience. So when we look at research, if a woman if her labor and birth isn't going the way she wants, she has a hard time recovering from that because it could be a once in a lifetime experience. And so if she's suffering from what happened during the labor and then she has this new baby, it sometimes makes it hard.
Well, you said that if the birth is not going the way she wants, and if it's a first-time mother, like, how does she decide, like, how she wants this birth to go other than quick?
Well, that's the thing. There's so many unknowns in labor, especially a first baby. So what we do together is prepare for all of those unknowns and set the conversation up ahead of time. So say her labor is not progressing and it's moving very slowly and her doctor may want to start Pitocin at some point. So we talk about that ahead of time, like what that would look like and when that was going to happen. And so if Pitocin comes up, which is a synthetic hormone that speeds up labor, if that were to come up at some...
Say that again?
Pitocin's a synthetic hormone that speeds up labor. So if her labor is not progressing at the way the doctor or midwife would like, she might have to get that. And so what we try to do is make sure it's talked about. So in the moment, it's not a huge surprise. And if there's no huge surprises, then we're not going to have all of this stress.
I mean, anxiety.
And the stress and anxiety, which we know stops labor. So it's the exact hormone that stops the production of contractions.
And I'm assuming that the baby feels the stress.
Yes.
I'm sure that
yes, like in nature, animals who are in labor, if they feel under stress or attack, they stop labor and they go to a safe place and they begin it again.
Really?
And so women do exactly the same thing.
Wow. Well, I was reading some statistics, and maybe if I go through a list and then you can talk about them a little bit and explain why. But I read that having a doula at a birth reduces the need for a C-section by 50%.
Yes.
Why is
that?
I
think part of that has to do with getting to the hospital at the right time. So, and also, so I think a lot of first-time parents get to the hospital way too early. And so if they're there too early, then they suddenly become in need for a kind of intervention to speed things up because their labor is not following this specific pattern that the doctors want it to. So we stay home as long as possible. We stay home until she's in actual active labor.
Agony.
Well,
when she's in agony,
we say discomfort. We say it's so generally that looks like if her contractions would be 4 to 5 minutes apart, lasting a full minute for a full hour. And that can take, from the start of the very first contraction, that can be 24 hours till she gets there. And most women are much more comfortable at home, and they do better at home. And so I show up in that early phase to keep them at home. And then once we get there, her labor's rocking and rolling, and it's very active, and there's not a need for intervention.
So they call you the first sign of anything.
Yes.
You're there.
Yes. And so, we talk on the phone. So another key is for me not to get there too early, because it's like calling in your lifeline too early. I get there when they really just are not sleeping, and it's, they're just not coping on their own anymore.
Okay. I also read that the length of labor is reduced by 25% when there's a doula.
Yes, because that's the stress. I think that's
the stress?
That's keeping the stress down, and she's feeling protected and safe.
I see. The use of narcotics reduced by 30%?
Because she has the support she needs, so she doesn't feel the need for the narcotic or epidural to help her get through.
Now, what happens if, she doesn't want it? She says she feels fine, but the doctor sees complications. I mean, the doctor's there seeing there could be a cord around her neck, or I don't know what else can happen in a breach or whatever. So how do you and the doctor deal with that?
Well, I have them ask the right questions. So usually there's very rarely a rush or emergency in labor. There's always it's like hurry up and wait kind of. So if the doctor's seeing something on the monitor, which is tracking the baby's heart rate, and the baby's heart rate's dipping, and it's going on, usually they'll be watching it for a few hours. And so we're talking about it during that time. Like it's never, very rarely.
But if there's a cord, that's emergency.
Yeah, so so that would be at the end during birth. So if they're looking at the monitor and there's something going on, there's usually a lot of warm-up for it. And we start having the conversation. And very rarely is there like a doctor or nurse running into the room and wheeling a woman out for a C-section.
It's not like on ER on television.
No, it very rarely happens like that. Sometimes it does, and thank God for C-sections, and thank God for the monitor for that.
Sure, absolutely. Forceps, I read also, the use of forceps are reduced by 30%.
Yes, and I think that has to do with women pushing at the right time. So we want the baby to labor down. That's
what does that mean?
Letting the contractions do the work for the woman. If she starts pushing and the baby's very high up in the pelvis, she'll end up pushing longer and she'll get exhausted. And so sometimes when that happens, there would have to be forceps or a vacuum delivery. And so what we talk about ahead of time in pregnancy is to wait until you feel the need to push or till the baby's very, very low. This minimizes the risk of forceps.
Okay, and epidurals reduce, and I guess that's because of the stress. Your life as a doula, I mean, we've been trying to get you on the show since October.
That's right.
But because, we kept saying, well, what is your delivery schedule? It really affects your life becoming a doula. You must get called in the middle of the night.
All the time. Yeah. So I have to plan ahead for everything. My schedule books up 6 months in advance generally.
And how many births do you accept a month?
I do about 3, sometimes 4, depending if I have 2 second-time moms who happen to have quicker births.
And you have to time them that they're not due the same time.
Yeah, they're not too close. Their due dates aren't close together.
Have you ever had a time where you in one and then and someone went 2 weeks early or whatever?
Yeah. So once out of about 100 births, I've missed 1 birth.
Oh, you've missed one.
Yeah, and I was at an induction. And sometimes inductions, which is. When you induce a woman, you try to bring the baby before the due date or because she's over her due date.
I see.
And so inductions can take a long time. So I was at one, and then someone else went into labor and had her baby within that time. So, and she was okay. I always have a backup doula. I always have somebody else who can go if I can't.
That works at your organization?
Yeah, we usually partner. We have me and the other doula. They're another independent doula, and we partner.
So that means your schedules have to coordinate?
It's very complicated. I was at a meeting last night or Sunday night with 10 other doulas, and we were trying to figure out a backup schedule. So we never miss births, and we're always there for each other.
Now, you keep talking about questions that the mother-to-be should be asking. Talk a little bit about the questions. Tell our audience the types of questions that they should be asking the doctors.
So yeah, the parents want to explore the kind of birth that sounds the best to them. So do they see themselves having a natural childbirth? Do they see themselves having an epidural? And once they get an idea of what they want, they can look for the doctor that's going to support that. So once they hire their doctor, they want to know, is there a limit for how long I can be in labor for? And if the doctor says all babies have to be born in 12 hours, then they know, all right, this guy might not be for me. If their doctor's very supportive of natural childbirth and wants all of their patients to have a natural childbirth, but my client wants an epidural, they want to know that.
Right.
So they want to know how long can their water be broken before they need to go to the hospital in labor. What does a typical labor look like for that doctor or midwife? And just asking a question like that lets them know, all right, so if your typical labor is natural or low intervention, then you might be the right care provider for me.
What should expectant mothers be asking you? So they come to you and say, I heard having a doula is a great thing. I never knew what a doula was, but all my friends say it's a great thing. What should they be asking you?
They should ask me what my philosophy is on childbirth. So it's the same thing. Like if I know some doulas who only do home birth. So they want to know, are you the kind of doula that does that? I happen to take hospital home births and birthing center births. They should ask their doula what does a typical birth look like for her? When does she come into the game? Some doulas don't get to the parent's house until active labor, and so that's all of that 24-hour time of early labor we talked about that nobody's there supporting them. So they want to know, is the person they're hiring going to be there for that?
Right. Well, I understand in the research that I did that some women hire doulas before they're even pregnant.
Really? Yeah. That's interesting. I've had a couple of those.
You had?
They've been my massage clients, for a year, and they know they're trying to get pregnant. And so that's actually the best way to do it. If you know you want to have a baby in a year or two, go visit hospitals before you're pregnant. Start getting to know OBs and midwives and ask for your friends' experiences with different people. Because that way, once you are pregnant, you're you're already on the right track. You're not scrambling to find a doctor, because a lot of times in New York City you can't get a doctor after 20 weeks.
Oh,
so
really?
whoever you have, you might be stuck with.
Mm-hmm. Why is that? Insurance?
I think they just book up. It's like insurance, compatibility. I think practices get really busy, especially the good ones.
Do you ever get involved with in vitro fertilization? Do women?
I've had a couple clients.
And,
yes.
And so what's your involvement at that point?
Well, I mean, as far as prenatal massage to help with relaxation during the process, that's definitely part of it. And then once they do become pregnant, that's when I'm hired. So I've worked with single mothers who've been single mothers by choice, who've used in vitro. And so then a doula is really important.
Yeah. Now, I know you and I spoke a few months ago about yoga for not only for pregnancy, but for women trying to get pregnant.
Yes.
And what does that do? Do you do that in your practice?
Well, there are some yoga instructors that work out of the Village Wellness Project, and Gwenola Horowitz, she's a wonderful prenatal yoga instructor, and she does do a lot of prenatal yoga. I think I'm not an expert in it, but as far as yoga goes, it's helping to balance the body. So that's the same with Chinese medicine, with acupuncture. So if there's something out of balance, it's going to be hard for a woman to get pregnant. So all of that's supporting the balance in the body.
Have you ever been involved in a pregnancy where there was something wrong with the baby?
No, luckily.
Thank God for that.
There's been some C-sections that were surprises that came out of nowhere, and we were really glad we were in the right place. But most babies every baby has been born healthy and fine.
That's wonderful, yeah, because that could be traumatic for you.
Oh, absolutely.
As the doula, that can be very traumatic. What training have you had?
Well, I have an advanced certification in prenatal and postnatal massage therapy, and I'm trained through CAPA, which is Childbirth and Postpartum Professional Association. I did my doula training with them. I'm also a certified lactation counselor that I got through the Healthy Children's Project that does a lot of the research for breastfeeding in this country.
Okay, and talk a little bit about fees. Are you paid by the hour? Are you paid by the pregnancy?
I'm paid for the service, so it's for the whole pregnancy. So a lot of doulas work on a sliding scale. I did for a long time. I still do. I have a base rate, but my service includes a free prenatal massage, and then the rest are discounted. At least 2 postpartum home visits. Prenatal home visits where I go to their house and we talk about the birth plan and we prepare. And then a lot of the fee has to do with being on call. So the doula's on call for 2 weeks before the due date. And that means she can't go out of town. She has to stay within an hour or 2. And then the birth, of course, and then I offer breastfeeding support postpartumly.
That's wonderful, wonderful. Well, I think I'm being accused that we're running out of time here. I can't believe it, how quickly this time went. I want to thank you for joining us this evening.
Thank you.
And I want to thank you, our audience, for joining us tonight and tuning in. If there's a topic that you would like us to talk about, you can contact me at Susan@BehindTheShadows.com. If you've missed any of our programs, you can log on to my website at www.BehindTheShadows.com and click on Public Access Television. And until next time, remember, the brightest light shines behind the shadows. Thank you.
Thank you. That went very quick.
I told you it was going to go.